Thank you for being here today. It's a real pleasure for me to get to come visit. The work that's being done in facilities like this certainly helps families all across the Metro East and all across Illinois. The opioid epidemic has devastated men, women, and children all across this country, and it's something that families living here know especially well. Residents in Madison and St. Clair County are buying opioid prescriptions at a rate that is much higher than the national average, and more families are seeing the harsh realities of what opioid addiction looks like. And we can certainly do a lot more. It's up to us to help make sure that those people who are in need of treatment can get access to the care that they need as soon as they need it. And it's up to all of us to do everything we can to stop the addiction before it even begins. That's why I co-sponsored the Jason Simkakowski Promise Act to make sure that the VA and the Department of Defense are working to reduce opioid addiction among our veterans. It's also why I co-sponsored the Comprehensive Opioid Abuse Reduction Act, the CARA. And what it does is that it will expand community-based prevention and treatment efforts just like the ones that are happening here, including those that are to combat addiction and help state and local government fight the opioid crisis in their communities. And what's been great about my visit here is really the partnership between this facility, the community, and state and local government. The fact that they are in the court system, as well as in the communities, as well as in your doctor's offices, making sure that there is not an excess in prescription of opioids. And it would help to expand life-saving drugs if we could, like naloxone. And we need to make sure that we also end outrageous pharmaceutical hikes in prices for things like naloxone and other life-saving medication that can really be literally the difference between life and death for many Americans. In fact, naloxone, a few months ago, I worked with Senator Patrick Leahy of Vermont to Colin Kaleo. It's a pharmaceutical company that makes the naloxone delivery device, not just the drug itself, but the delivery device, the injectable apparatus itself. And we wanted to know, why did they dramatically increase the price for that device, making it out of touch and unaffordable for so many programs. It went from less than $700 per unit in 2014 to $4,500 today. So just in 3 years, it went from $700 to $4,500. And we're working to hold them accountable. And get them to explain why they are doing this. I'm proud of the work that I've done to limit these price hikes and provide assistance to those who are struggling with opioids, but I know we need to do so much more. That's why I'm really disappointed that instead of helping solve this epidemic, President Trump and Senate Republicans are taking strides to reduce resources and funding during a moment in which our families need these resources. I'm headed back to D.C. this afternoon. I have votes at 5:30 today and in D.C., and we're going back to this fight over Trump Care and the significant cuts it makes to programs like Medicaid, to programs that deal with opioid addiction treatments, and simply we can't support these programs. This bill was written by 13 men behind closed doors. Nobody was allowed to look at it until it came out. And not only does it cut funding and makes treatment harder to access, this Trump Care bill actually gives billions of dollars in handouts to the very same pharmaceutical companies that have helped contribute to the opioid crisis today. I think that's simply shameful. So I'm doing everything I can to try to stop it in its tracks and push against those who limit critical resources to help people who are fighting both drug addiction, but also who are dealing with other behavioral health issues and challenges that can certainly be treated and cared for. And I want to make sure that we do not lose any more children to this epidemic. So to resolve this crisis, we need, I think, a comprehensive, fully funded effort from our officials at all levels of government and from local community organizations like the Chestnut Health Systems. And it also requires us stopping the harmful Trump Care proposal that I will be considering when I get back to the Senate today.